Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes. Are you ready for your doctor's appointment? Are you making the most out of your doctor's appointment? It's kind of important to have a game plan. And how do you prepare for it? We're talking with Dr. Cyrus Hajiran today about that and how we can make the most out of our time with our providers. Thank you so much for being here.
Sure.
Tell us, how important is it to have a game plan, and what do you need to do to kind of make the most out of the time with your providers and your doctor?
Sure, that's a great question. So first thing I would say is, if the idea of coming to the doctor is anxiety provoking in general for you and you don't want to go through extra preparation, come as you are, and my job will be to get the right information, what we need to talk about, and go from there. But if you do feel like you can take the time and take that extra step to prepare, so one of the most helpful things you can do is bring a medication list.
And so your medication should have name, milligrams, times per day. I mean, how detailed does it need to be?
As detailed as possible is helpful. Some patients even bring a bag with all their medications. If you don't bring any, or you're not sure what you're taking, we always can reach out to the pharmacy and try to figure out what you've been taking, what you've been filling. But medication reconciliation, or figuring out what a patient's taking when they're coming in and what they're taking when they leave, is really important, so they're not errors which can hurt patients.
Is it helpful to have like a list of concerns or things that you want to discuss? I feel like whenever I've taken my children to the doctor, or if I've gone myself, sometimes in the flow of the conversation, I forget to address a couple of things.
Sure. Patients come in with lists, and they can be great tools for sure. If you do come with a list, it's important to try to rank the list, to talk about kind of what's most important to you first. But it's a great way to keep track of your thoughts and what's been bothering you recently, because once you get into the doctor's office, it can be pretty easy to forget to bring up something that you've been meaning to talk about for some time.
You mentioned anxiety. Sometimes that makes your blood pressure, that white coat anxiety can make you nervous about seeing your physician. How can you address some of the stress about just checking in medically?
Sure. As far as anxiety before a doctor's visit, trying to get to know where the clinic is, or get a recommendation from a friend or family member who felt like they saw a provider who really listened and who they clicked with, could be helpful. Coming prepared as possible, like with a medication list or like with a list of your concerns, also could lessen some anxiety. Just trying to be as open-minded and as honest as possible with your doctor is always going to be the most helpful thing.
What about bringing a friend with you or bringing a relative with you to kind of help you through the appointment? Is that a good idea?
Sure. Definitely that could be a great idea. Bringing a friend or family member could be helpful, especially if you come into the office and you are feeling anxious. That friend or family member can help, bring up or report important pieces to the history if the doctor or provider starts asking you questions and you can't remember on the spot. Also, that friend or family member can help to remember some of the details that your provider told you about what they think is going on or what the plan is if you forget, if you are feeling nervous.
And what about hearing? I mean, sometimes patients can have issues hearing things or seeing clearly. It's important to have all those pieces in place because you may not be able to communicate effectively with your physician.
Sure. That's another thing that comes back to trying to be as honest as possible with your provider. Some patients I've had even are kind of embarrassed, and they'll tell me at the end of the visit that they couldn't hear as well, or their friend or family member will tell me why there's a communication issue going on. So first off, just being honest. If you can't hear or you can't see or you don't understand what your provider is saying, be honest so that we can change the way that we're trying to help. But making sure if you do use hearing aids or do use vision aids, to try to come as prepared as possible can make the visit as most productive as possible.
Yeah, I like that. Just being honest. You're there to help, there to address their concerns.
Right. Sometimes, a patient will even save their most important or pressing question until we go to reach the door handle. It's called the door handle phenomenon, which is okay.
But wait, one more thing. Yeah.
And so we will address that, if that is how it happens. But trying to think about what's most important to you and talking about that first will get you the most, bang for your buck out of the visit.
I like that. Some great ideas on how to make the most of your visit with your provider and your physician. Thank you so much.
Sure.
We appreciate talking with you.
Sure, anytime.
Thanks for being here for Monday Health Minutes. We'll see you next week.